Hello friends, welcome back. And in this short video lesson, we shall explore why the so-called disease model of pain does not work. What exactly do I mean by the disease model is that pain has been medicalized, whereas pain is not just a problem which will be cured by medicine alone. In most cases, we need to go beyond medicine, and that is why we need to engage in integrative therapy. And one of the most effective therapies is the triple helix technique, about which we are learning in this particular course. When we try to understand pain, what exactly do we mean by saying that the disease model has failed? Just consider a few facts. At any given period of time, between 10 to 40% of the population in any part of the world is suffering from pain. And the standard modes of treatment are failing them. Did you know that the average expenditure that is spent every year for pain medication exceeds the defense budget of the United States of America, which spends almost half the total amount of money that is spent on armament and other military expenditure? All the current medications and surgeries have not been able to solve a very fundamental suffering that humans are undergoing since times immemorial. And the reason for that is that we must not consider pain on the same lines as we consider disease, which is about seeking a diagnosis and finding a cure to fix it. Because pain can happen even without disease. Pain can happen without injury. Take the example of childbirth. Childbirth is a normal physiological function, and yet it is associated with pain. There is no disease and there is no injury when it comes to childbirth. Another interesting example is war injury. Soldiers sometimes are able to continue fighting a battle even when they are seriously injured. They are virtually able to block off all the pain. We shall be seeing an example of a war injury later in the course to get a better understanding of pain. So pain is something that goes beyond medicine and something on which we can't apply the disease model. Usually, when it comes to pain, people go for some kind of a pathological examination or some radiological examination. For example, if there's somebody who's having a back pain, he or she will be asked to go through an MRI or a CT scan or a PET scan. And then that patient is tutored by the doctor. The patient is shown an MRI or an X-ray of a so-called healthy spine, in which he is shown the beautiful structure of the spinal cord. And that is compared with what pertains to the patient. On closer examination, the patient is told that his spinal cord is pinched at this particular location. He is given a number, or there is some kind of a deformation, or that there is a disc has been squeezed out of place. There's a herniation of a disc. And these are the explanations given for that pain, which in this case could be a back or a neck pain. Interestingly, if we refer to this article from one of the top medical journals called Spine, which deals with pain, here is a paper entitled Spinal Radiographic Findings and Non-Specific Low Back Pain. This was a 1996 program committee report, and it's a systematic review of observational studies. So it's actually a study of many other studies. And what does it say? This particular study says that it has made the conclusion that there is no firm evidence for the presence or absence of a causal relationship between radiographic findings and non-specific low back pain. In simple English, what it means is that your MRIs are not associated with your pain. There is no evidence that any kind of a radiographic finding has anything to do with back pain. This is quite shocking. Here is another study which was published way back in 1998. This is from the Baylor's Clinical Rheumatology, and what it says is that degenerative changes of the spinal column have long been and continue to be confused with the presence of spinal distress and pain. All parts of the spine undergo degenerative changes as we age. What this means is that very often people are told that just because they are getting old, there is degeneration of their spinal column, and that is leading to pain. But this particular paper has to tell us that it has nothing to do with degeneration. Pain has no association with that. Here is another very interesting study dated 2008. It deals with facet joint osteoarthritis and low back pain in a community-based population. This was also a very big study. It was actually a heart study, and it was known as the Framingham Heart Study. And they involved something like about close to 2,000 people. And they had tremendous amount of data, and they had various radiological examinations and a lot of other stuff. And one of the sub-studies was the study of facet joint osteoarthritis and lower back pain. What they found was that in the present study, we failed to find any association between facet joint osteoarthritis identified by multi-detector CT at any spinal level and lower back pain. In other words, even if you see some kind of a damage or injury or any abnormality of the facet joint due to osteoarthritis, it has no association with lower back pain. They found a lot of people with this kind of a deformity had no back pain. And there were a lot of people who did have back pain and they had no radiological findings. So this is all very interesting stuff, which goes to tell us that there is a lot of work to be done by healers like us. And one of the most effective tools that we can use is the triple helix technique. Let's take a brief look at the allopathic approach of dealing with pain. This could be any pain. So the first line of action is muscle relaxants. They're supposed to relax your muscles and other tissues and provide you some pain relief. Sometimes they work. The next line is anti-inflammatories. That is assuming that there's some inflammation which is causing pain. But there is a lot of pain without inflammation. In fact, there can be a lot of pain without, even though there could be no injury. Next in line are analgesics or painkillers, the non-steroidal over-the-counter painkillers. And if they don't work, then they put in cortisone shots through injections. And the last resort is surgery. Now let's see what surgery offers to the patient. Now here is a report which is titled, "Is Spinal Surgery Effective for Back Pain?" So the question is, how effective is surgery? And this is a report from 2009, and you can Google this document and see that in detail. Very briefly, what it says is that there have only been a few randomized controlled trials of surgical treatments of chronic low back pain caused by degenerative disc disease. That's quite a severe criticism of evidence-based medicine. And it says there have been very few randomized controlled trials. And it says that is little solace to the majority of patients who do not do well or who suffer complications or who are rendered worse by surgery. In other words, most of these surgeries are a shot in the dark. That brings us to the end of this lesson, and what we learned is that the disease model for pain does not work. We need to have an integrative approach using various methodologies, one of which is the triple helix technique, which incorporates three different proven healing modalities, and we shall be learning more about them as we progress through the course. So thank you very much for your attention, and meet you in the next lesson. Bye bye.